My name is Diane Berson. I'm a dermatologist in private practice in New York City. I've been using the Aerolase for a few years, and I've found it to be a very helpful adjunct for my patients with acne, certainly for those with inflammatory acne. It has a few mechanisms of action. It does help decrease inflammation and erythema, has some anti-inflammatory properties, and possibly decreases the vascular inflammation. It affects porphyrins and P. acnes, similar to the effect we might see when we use blue light and PDT, and in that sense may have some antimicrobial properties. And it also has the deep heating, the thermal effect on sebaceous glands and sebum output. But patients seem to really like the treatment. The laser doesn't actually touch their skin, so there's really no pain involved, just a little bit of heat, but certainly it's very well tolerated. And I usually perform 3 to 4 passes on the patient's entire face, and then I go back and hit each of the individual lesions separately with the laser. Again, I found it to be a very helpful adjunct for patients who have inflammatory acne. It seems to more rapidly resolve their lesions, and it's something that I can use in addition to the oral and topical therapies that we already have available to us in our armamentarium. You can call this an adjunct to treatment, and it may refer to the oiliness on the surface of their skin. It may refer to the inflammation and more rapidly resolve the inflammation. It may speed up the results, and it might give them a more cosmetically pleasing result. I think we're appreciating the fact that the root cause of many of the conditions we see, whether it's acne, rosacea, psoriasis, or even melasma or photoaging, that the root cause is related to inflammation. So any device that we can offer to a patient which can decrease their inflammation and erythema might actually have a beneficial result for all of these conditions that we see in our patients. I think it's always nice to be able to offer our patients an in-office procedure which may help expedite the response to their therapies. Certainly if it decreases inflammation, it might more rapidly resolve their acne and possibly decrease the development of post-inflammatory erythema or even scarring. I think a lot of patients become more compliant when they see more rapid results, and a lot of patients enjoy having procedures done in the office. Now we have some devices that really work well, and there are a lot of patients who I think like the idea of having a device added in to their regimen.